Yeah. All set. I see Commissioner Thomas is on the line. Appears to be. Okay. All right. We'll go ahead. Good afternoon, everyone. Call us to order for the Monday, November 16th, 2020, Board of County Commissioners Special Business Meeting. Would you please stand and join us in the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. So we are both in person and virtual. And I see Commissioner Thomas has joined us virtually. Commissioner Thomas, welcome.
Thank you, Commissioner Partridge.
And Commissioner Layden is excused for today's meeting, but we do have a quorum. And I will ask, I'm not sure which attorney, I'm looking for counsel on the line for certification of our agenda.
I think that since today is a special business meeting, I told the commissioner or the attorneys that they could have the day off. For the meeting off, I should say.
Very good. So Doug, you kind of cut out there. And I was, so do we require, do we require attorney certification? Or are you?
No, sir.
Okay. Very well.
We're certifying that you've become a dictator. It looks like you're the only person in the room, so.
Very well. We're having a hard time hearing you, Doug, there, but I think we got the gist of it. Good. Very well. I guess for any disclosures for any commissioners on the call?
I have none, Commissioner Partridge. Thank you.
And I have none. So it brings us to our regular agenda item. This is a celebratory signing of the CARE Compact Memorandum of Understanding, a program of the Douglas County Mental Health Initiative. Presenting for staff is actually our Deputy County Manager, Barbara Drake.
Good afternoon, Commissioner Partridge, Commissioner Thomas. I want to quickly go over our agenda for the meeting and then make a couple of opening comments. So I want to welcome everybody to this meeting. We will spend a little bit of time talking about the CARE Compact, and Laura Cinconi and Leandra Marquez will be doing a PowerPoint presentation on our CARE Compact. We then have a lot of time for our partners, many of whom I see have joined us remotely, to talk about the reason why we are partnering on the CARE Compact. Then hopefully comments from our Board of County Commissioners, and then a motion and signing of the Memorandum of Understanding that brings us all together. So with that, I will make some opening comments. First, I want to start by thanking the commissioners for their support, not only of the CARE Compact, but this really started back in 2014 with the creation of the Douglas County Mental Health Initiative, which is sort of the parent organization over the CARE Compact. The community response teams, our co-responder teams, the blueprint that we have developed for an integrated mental health delivery system in Douglas County, and now the CARE Compact, and they're all connected. They all have to do with making sure that the citizens of Douglas County have access to quality mental health and substance use disorder services. If you recall, one of the things that when we started our co-responder program, we wanted to avoid taking people to a jail, avoid taking people to the emergency department. But the third goal that we always had, and probably the most important of the goals of that co-responder team, was to connect people to appropriate mental health and substance use disorder services. So they were not using our emergency services to get mental health help. And that's really where the care compact comes in. So it's that ring around our co-responder and our emergency services that keeps people and gets people connected to appropriate services in the community. The care compact, and you'll hear from our partners, the care compact is really only possible and is coming about because of the collaboration that we have among the members of the Mental Health Initiative, and because of the trust that has been built among all of the partners of that organization. That when we sort of put out the call, if you will, to create this care compact and make it a reality, we had a lot of willing partners come to the table recognizing why this was an important thing to do. The name, actually, I have to give credit to Centura Hospitals because they actually came up with the name Care Compact, and we liked it, and so we decided to continue with that name because we think the term compact really reflects a stronger commitment to each other and to serving the people in our community than simply saying an agreement does. So with that introduction, I would like to turn it over to Laura Cinconi, our Douglas County Mental Health Initiative Coordinator, and Leandra Montoya, who we recently hired as our Care Compact Navigator, to present information about the Care Compact program. And then we'll hear from our partners.
Thank you, Ms. Drake.
Thank you, Barbara, and good afternoon, everyone. This is Laura Cinconi for staff. I'm going to add on what Barbara started in her opening comments about the history of the Mental Health Initiative, which was established in 2014 following tragic events that took place in the Douglas County community. And leaders at the time started to think that we could really do better as a community in terms of assisting people with mental health needs and helping to make sure that they don't fall through the cracks and have access to services in the county that could meet their needs. From there, a group of partners was gathered, and the first thing that was done was process map how all partners were helping people to address mental health and substance use disorder. And these steps were really key in building a foundation that has allowed us in the Mental Health Initiative to do much of the work that we've been able to do up until today. And that was entering this process saying that we're not going to blame anyone for what's not happening right now. And the purpose of process mapping is to just understand what points of the system people are falling through the cracks. And the group also had the mentality that it's not just the problem or an issue of the behavioral health industry or providers in the behavioral health system to solve. It's really all of our collective problem to come together and solve some of the challenges. So what is the Mental Health Initiative addressing? Over time, we're addressing a siloed mental health delivery system, access to services, spaces where there's fragmentation or duplication of services across multiple providers, and addressing gaps, bringing in services that don't currently exist in the community. We're also addressing the stigma associated with seeking treatment, and we want enhanced care coordination, especially in cases where people are moving from one setting to another. And this could be from one level of care to another, or from a hospitalization back into the community. With our Community Response Team program, or CRT, we wanted to address mental health crisis and reduce the revolving door, breaking the cycle, connecting people to care and ongoing support in the community, and reducing the burden on our hospitals, 911 system, emergency medical system, and making sure that individuals in our Douglas County community didn't have to rely on emergency services to get their needs met. The CRT is an example of how diverse stakeholders can come together and address unique community challenges. And the Care Compact, the reason that we're all here today, is another example of that. Before we start speaking about the Care Compact, something else that the Mental Health Initiative and the county did along this journey that was really key was to step back. After about a year to a year and a half of running the CRT program, we wanted to take a look at the larger system and really what it meant to have a strong community-based mental health delivery system. So the county contracted with Health Management Associates, and HMA helps the Mental Health Initiative through a stakeholder process that included data analysis, focus groups, key informant interviews, surveys, and group work at our meetings. And what came of this was a blueprint for an integrated, community-based mental health delivery system that the Mental Health Initiative uses as a guide for our current and future projects in which we are currently implementing. This was a real pivot point for the Mental Health Initiative. We developed and operate under a common vision, and we established work groups to intentionally focus on key goals highlighted in the blueprint. Across all of our goals and all of our priorities, we keep this stepped model of care in mind, which recognizes that a strong and supportive system has elements across the board, from prevention and health promotion, which reaches the community at large, to integrated services and supports for mild to moderate mental health at the center of this model, all the way up to specialty services, crisis, and acute care. So the Care Compact is both a product of what we learned from creating this blueprint together, and actually quite a bit of what led us to the Care Compact as well came from what we learned running the community response team. So both locally and across the state, whole person care coordination for individuals at high risk, with high needs, with co-occurring needs, is a gap. And there's real need to work collectively to build a network system of care. So we know this from our blueprint. We know this from a recent needs assessment for the Office of Behavioral Health. And even the Governor's Behavioral Health Task Force identified this as a need. And what we saw play out locally, time and time again within the CRT, was individuals with the most significant behavioral health needs were not getting the intensive case management that they needed to have sustainable and positive health outcomes. So these folks would circle in and out of crisis, and our community response teams and others ended up becoming the safety net. These folks often exceeded the threshold of what CRT case management could provide, but just weren't connecting to the supports that they needed in the community. So it wasn't working, and it's not sustainable or the answer to a client's long-term stability and health. So the Care Compact adds this extra layer of support and service around the CRT. It leverages existing care coordination and case management services already being provided in our community and enhances communication and coordination across these multiple systems. And in a system like this, we believe we will reduce duplication, improve efficiency, improve client transitions between levels of care, so people aren't falling through the cracks as their needs change, and ensure that we are lifting barriers through addressing whole person health. And we're so fortunate through our mental health initiative to have a great network, to have established trust with one another. We've established credibility through our work and being action-oriented, and our partners see that collaboration can bear fruit. So with this foundation, it was relatively easy for us to pull our partners together for this pilot, and we're really grateful for that. And I also want to mention, before I turn it over to Leandra, how essential the backbone agency is in supporting collaborations like this. The county plays the role of the backbone for the mental health initiative, which just means that we facilitate the process. We allow a platform for collaboration to happen. And we hear from our partners how important that is in furthering our vision. So I'll talk a little bit more about partners in a moment, but I'd like to turn it over to Leandra Montoya, Care Compact Navigator, to share some information and stories that demonstrate why this is so important. Leandra?
Thank you, Ms.
Thank you,
Sinconi.
Laura. As Laura alluded to, some of what we recognized as really needing improvement in the Douglas County Mental Health Initiative group was actually quite in alignment with what we were hearing from community members. So just to give an idea of the kinds of concerns the community was voicing about the mental health system, we've shared some themes from the State Behavioral Health Task Force public testimony that took place in Douglas County last year. These are from the voices of clients, family members, and providers that have had involvement in the mental health system. So people were mentioning that there were difficulties actually getting to treatment and accessing treatment, and that they were not able to get the help they needed for themselves or their family members. There was also difficulty accessing care for individuals with an intellectual and/or developmental disability. Folks were noticing that there were gaps in the continuum of care for high-level needs individuals who are no longer appropriate for hospitalization. There was a lack of timely access to providers, so people were having to wait longer to get the help that they needed. And folks across the board were commenting on what they perceived as system failures. Many people were also arrested and taken to jail because treatment was not available. I do want to mention that these themes are not unique to Douglas County, and in fact, due to seeing similar concerns of disconnected systems across Colorado, as Laura mentioned, the Behavioral Health Task Force has indicated a real need to address these disconnected systems through developing a statewide care coordination model in the future. So it's quite exciting to note that Douglas County is actually leading the way to this development at the community level and may serve as a model in future statewide developments. So in this next slide here, I want to highlight some client stories to focus in a bit more on these concerns with specific examples. Here are two stories of real people living in Douglas County with high risk cross-system needs who could really benefit from an improved care coordination model and support. All identifying information, including names, were redacted to protect these people's confidentiality. So the first story here is of a man named Cameron who was diagnosed with schizophrenia. He lives with his parents in Douglas County and has a history of struggling with substance abuse. He's recently started displaying mental health symptoms such as hallucinations and delusions, and he's had almost daily contact with the local police and frequent contact with the community response team due to neighbors and his parents calling 911 out of concern. He's had 2 emergency department visits, 3 psychiatric hospitalizations, a report made to adult protection, and 2 arrests in the last 3 months. Parents are in their late 60s and have been actively involved in trying to advocate for more support for their son. Owen, on the other hand, is an adult male with an unspecified intellectual disability, living with his mom in Douglas County. He's reported struggling with suicidal thoughts and has had difficulty taking care of his basic needs, such as hygiene, forgetting medication, and not eating. His mother reports Owen has a violent temper and will become physically and verbally abusive when frustrated. There are regular contacts with law enforcement due to safety concerns, and CRT has also had contact with the family. A report to adult protection was made, as well as a referral to developmental pathways in Rocky Mountain Human Services. the client's mother is no longer able to have Owen stay with her due to these safety concerns mentioned. Therefore, housing and financial needs are also a presenting concern for him. So Laura will now speak to how we aim to address these types of concerns for our community members through the work of the Care Compact and our amazing partners.
So taking a moment at this point in the presentation to both celebrate and recognize the partners who have been working weekly to create the Care Compact pilot. We have All Health Network, our community mental health center, Caring Communities of Colorado, who supports the community response team with clinical staff, Centura Health, Case Management, Colorado Access, our regional accountable entity from Medicaid RAY, Rocky Mountain Human Services, our regional single entry point, Signal Behavioral Health, our regional contractor for substance use disorder services and crisis services, Health One, Skyridge Medical Center, The Rock Church, our faith-based partner, Developmental Pathways, our regional intellectual and developmental disability partner, and Douglas County, which includes Human Services, the Board of County Commissioners, County Administration, and IT with their assistance in implementing GLOTA. So congratulations to all of our partners. Thank you all so much for your support over the last few months, and you've been wonderful to work with. Every single partner on this screen is essential to creating this network system of care. And I also want to specifically highlight our faith-based partners. So we have quite an array of people at the table, and our faith-based partners are really key as well, because they're helping to make sure that we address safety net needs. So we have physical, mental health, substance use, and IDD providers, but also essential to health are things like food access, access to safe housing and transportation. And The Rock, who's our faith-based partner at the table right now, is helping make sure we can fulfill those needs. So this is the model that we're operating on for the Care Compact pilot. On the left-hand side, we have systems that we would like to limit interaction with as much as possible. These are the systems that we don't want people getting their ongoing mental health treatment. But what I think is really unique about the Care Compact is that we're not just partnering in this wraparound model that you see on the right. We also partner with the agencies and entities on the left, because everyone plays a unique role in closing the loop and making sure that clients are directed towards the most sustainable, appropriate levels of care and away from levels of care that are meant for single use or not meant for mental health care at all. On the right-hand side of the slide, you can see that this is a patient-centered model with the client or patient in the center and surrounded by an array of various service providers. In the middle, the client, a patient, is working with a lead provider. This is the entity that works most closely with the client and can change depending on the client's primary need. So for one person, it could be the community mental health center, whereas another, it might be developmental pathways. Each client, therefore, has a unique team based on their unique needs. And also critical, the Care Compact Navigator, also in the center, supports the process and coordinates the coordinators. So this role isn't necessarily to provide direct case management to a client or a patient, but to ensure that there is system accountability, that the right partners are working with each client, that the program runs smoothly, and that we're tracking data and client and patient outcomes. So I'll turn it back to Leandra to talk more about the Care Compact pilot.
Thanks, Laura. So to give you all a sense of the population that we will be focusing on in the pilot of the Care Compact, we thought it'd be helpful to share the criteria of the intended pilot population. The goal here in the creation of this criteria was to identify individuals with cross-system needs who could really benefit from this enhanced care coordination model. So for the pilot, we will be working with clients who are adults and meeting 5 or more of the following criteria. As you'll see in this list, several different systems are represented in this risk template. They must have a mental health and/or substance use disorder, but they may also have a co-occurring physical health condition and/or intellectual and/or developmental disability. They may have involvement or risk of involvement with adult protection or the child welfare system, contact with law enforcement, or near future release from a criminal justice setting where they'll be in need of support upon release. There may be 1 or more crisis contact with CRT or mobile crisis within the last 60 days, emergency department utilization for behavioral health concerns, or recent psychiatric hospitalizations. So as you'll see, having 5 or more of these crossed off with this level of risk would be a sign to us that the community system needs to step up to better serve these individuals and coordinate care. So for the pilot evaluation, from both a quantitative and qualitative standpoint, we're really looking for a reduction of risk and the decreased utilization of these crisis emergency level systems to understand the effectiveness of the Care Compact. We're also going to be seeking feedback from clients and family members about their experiences being served by the Care Compact to learn more about what's working and what still needs work. We're also hoping that providers and partners will share about their experiences participating in the Care Compact meetings and staffings as well, in order for us to make any necessary improvements to internal workflow and processes and organizational roles as well. And all of this information gathered through this evaluation will help us address concerns early on as we get ready to launch the full program, and will contribute to a phased communication plan that the Douglas County Public Affairs team is working on. So in this next slide here, with all of that buildup, let's go ahead and look at how we're planning to launch the Care Compact. We have established an initial 4-month pilot period to be extended if there's still significant changes to be made towards the end of that period. But as you can see here, initially, we're planning on starting pretty small for the pilot with about 3 to 5 test cases in the first couple of months to provide adequate time to see what works. However, over the duration of the 4 months of the pilot, we are hoping to work around 7 cases total, at least. So in this first phase, we'll be tracking our process metrics, and we're also going to be starting on paper to really nail down our workflow and easily make adjustments as we go. In our operations work group, as we're getting to adapting the processes, we're going to really be implementing feedback from team members regarding the paperwork, the workflow, and perhaps the criteria even, and any other changes that are identified to make the Care Compact run smoothly and make sense for all partners and participants. So once we iron out these issues, we hope to formalize all of these components, starting with Gelota as our secure information sharing software. We will create workflows and data collection points from what we learned on paper. We will work on getting partners and users trained and eventually also formalize the data collection process. So once these steps are addressed and agreed upon, we expect the ongoing Care Compact to run naturally from there, with continued monitoring, adaptation, data reporting, and eventually expansion in order to serve more people in need of that care coordination support. So I know we are all so excited to launch our pilot after this MOU signing. And I just want to extend another note of deep appreciation to our partners who have devoted so much time and energy to this project. And a sincere thank you to the Douglas County Commissioners for your support of the Care Compact vision. Please reach out to myself or Laura with any questions about the Care Compact or the Douglas County Mental Health Initiative. And now I will turn it over to Troy to lead us towards any comments our partners would like to share about the Care Compact.
Thank you both, Mrs. Cinconi and Mrs. Montoya. Mrs. Montoya, it's a pleasure to meet you. We have not had the pleasure. I don't know if Commissioner Thomas has had the pleasure to meet you yet, but very good job. Really appreciate it. Thank you very much.
Thank you. Nice to meet you as well.
So it looks like we do have, this is Barbara Drake again for staff. Looks like we do have some partners on the phone. And so Troy, if you would just identify those folks, we're happy to hear from them.
Thank you, Barbara. First of all, I wanted to tell the group how you can raise your hand in order to make comments and suggestions regarding this meeting. If you look at the bottom of your screen on the right-hand side, there is an area that's labeled Participants. Please click on that window and that will bring you to a list of everyone that is participating in this meeting. If you scroll all the way to the bottom, on the very bottom right of that screen is a small picture of a megaphone. If you click on that picture, it will open another submenu where you can raise your hand. I'll be monitoring the interactions and will call on you in order of receipt. If you have any questions, you can chat people as well. That is the bubble next to the participant window. That will come to the presenters and to myself, and we'll be able to assist you behind the scenes and get you up onto the screen. So at this time, if you are already in the menu as a presenter, I'm going to call on our first raised hand. You may go ahead and unmute yourself when I call on your name, and that would be Matt Van Auken. Matt, go ahead and unmute.
All right, I think I did that correctly. Can everybody hear me okay?
Yes.
Yes, thank you.
Wonderful. Just some quick comments if I could. Thank you very much for inviting us to today's meeting. As most of you know, Developmental Pathways is the IDD service agency that serves over 3,000 children and adults in Douglas County with intellectual and developmental disabilities and delays like autism or Down syndrome. We believe that the benefits to people with IDD of the Douglas County Mental Health Initiative, and specifically the Care Compact program, connects those vital dots that are so often not connected because of a lack of coordination, a willingness for various organizations to share information, and general silos that exist that similarly occur in all parts of our state and nation. This groundbreaking work will help to build bridges from silo to silo in the hopes of each of our organizations being able to better serve the individuals together. As in many organizations, a relatively small percentage of the people that we serve utilize a great deal of our resources and energy. So as an example of the over 3,000 individuals that we serve annually in Douglas County, there might only be 30 that really utilize a great deal of our resources and energy. An example for us is someone that might fit this need is an adult with an intellectual or developmental disability diagnosis that also has a mental health diagnosis, a significant physical disability, and high healthcare needs. So that person that utilizes a great deal of our energy or resources also typically utilizes a great deal of energy from our Care Compact partners as well. Allowing us to work better together, as this program will allow us to do, will benefit all organizations participating, the county overall in making resources more efficient and cost-effective, but most importantly, it will benefit the Douglas County citizens that we collectively serve. We would like very much to take this opportunity to thank Doug DeBoard and Barbara Drake for leading this effort, our Douglas County government partners like Dan McKelkey and the DHS team, Jennifer Eby and the Community and Resources Services team, the other member organizations participating in this vital work, and also Commissioners Partridge, Thomas, and Layden for supporting this life-changing work for people most in need in Douglas County. Thanks again for having us here today.
Thank you, Matt. Really appreciate all your efforts and your wonderful comments.
This is Troy, your host. If you'd like to make a comment, go ahead and raise your hand. All right, Bill Hendricks, go ahead and unmute yourself, sir.
Thank you. I just wanted to call out Supervisor Thomas and Barbara Drake and their efforts in pulling us together. I've had the opportunity to work in behavioral health for 30 years now, and working around the country. I think what Douglas County is doing is unique in pulling us all together and helping us to develop that sense of trust and sense of agency and working together for a common vision. There are numerous unmet needs in the community, but I'm increasingly hopeful that through the Care Compact and other aspects of the mental health initiative that we will find solutions to those and do a better job going forward, meeting the needs of the community than what we have done historically. And it's an exciting time to have the recommendations from the state's behavioral health task force coming to Douglas County and the local providers and working together to implement some of those recommendations. Just an exciting time. And it's a great time to have additional resources and working together when we as a community are struggling with so many issues that seem to be overwhelming, but this really does give us a sense of hope. So thank you so much for your coordination, and I look forward to continuing to participate in the Care Compact and working together going forward with the other partners to this group. Thank you.
Thank you, Bill. Again, appreciate your comments and your association.
Thank you, Bill. All right, Matt, go ahead and unmute yourself. Okay, must be a technical difficulty. If you have raised your hand and you are done, go ahead and click that raised hand again and that will lower it. We'll move on to Amanda. Go ahead and unmute yourself.
Hello, everyone. My name is Amanda Lighthizer. I'm with Rocky Mountain Human Services. I also just wanted to thank everyone for this opportunity. We really appreciate being at the table and being able to talk about some solutions that are going to meet people's needs. We are new at the single entry point and providing case management for long-term services and supports, and really working with the community mental health supports waiver, and getting people connected with long-term case management. Also have behavioral health transitions case management that we also want to bring to the table and have as an option for people. But really being a part of this group, I think the most helpful thing is we want to be able to work with our partners so that people have access to services. And sometimes I think that Rocky Mountain Human Services is able to come in as a solution to some of the problems that people are having to be able to provide those long-term services and supports to help people live in the community. And sometimes we really need the support of our partners when people have acute needs and we're stuck and we don't know how to find the best solution for people at the time. So we're very excited to get to know all of these partners better and to be able to work collaboratively to really make a difference in people's lives. So thank you.
Thank you for your comments and your association, Amanda. We really appreciate you.
Okay, thank you, Amanda. Let's move on to Sharon Easton. Go ahead and unmute yourself, Sharon.
Hello, everybody. This is Sharon Easton. I'm the foster care and adoption coordinator here at the Rock Church. In addition to working with agencies, I've had the pleasure of serving on this committee and also working with our own county's DHS department in the area of foster care. One thing that kind of came out of that was a program that we are now trying to link. It's a platform called Care Portal, and that coordinates churches and responders in those churches and connects them with the needs that caseworkers put out, and then needs that will also come from the Care Compact. So that's been a nice way to organize those things. When you have a request and a need, it links them really rather easily rather than lots of text, emails back and forth trying to get people's needs met. As you all know, we also have the food bank at the Rock on Saturday mornings where we serve a lot of people food for free. We have Thursday night meals that we also provide that are hot meals ready to go. And we have our blessing room, which is basically free clothing and other household kind of items for anybody that's in need. So those are kind of things that we're doing here at the Rock, and I'm thrilled to be able to work on this committee with all of you.
Thank you, Sharon, and we really appreciate the Rock, and you've been a partner in so many things, but this is just another one that you really bring to the community. Thank you.
You're very welcome.
Thank you, Sharon. Mr. DeBoer, go ahead and unmute.
Yes, this is Doug Muir, and I'm the Behavioral Health Service Line Initiatives Director with Centura Health. And I want to echo a lot of what's already been shared. Really honored to be a part of this initiative and really appreciate the role that Douglas County has played. It was mentioned in the presentation, the importance of a backbone agency, and it makes all the difference in the world. I've been a part of a lot of regional and community collaborative initiatives, and the mark of the success of this program is in large part due to the passion of the participants and the participation and the leadership of the Douglas County Commission and community. And I'm very excited to be a part of this work, and it truly is an example for the region. It's interesting, when this started, the CRT program partnered with El Paso County. They had led out on some of the early community response team work. But the way this collaborative has advanced, now El Paso is approaching Douglas County and saying, how do we take the work that we're doing to the next level? And it truly is remarkable, the level of groups that are partnering to realize and committed to making a difference and to changing and transforming the way individuals are supported in the community to realize new outcomes. So greatly appreciated, and Centura Health is honored to be a part of this initiative. Thank you.
Doug, we really appreciate you joining us. Thank you for your comments.
Thank you, Doug. We'll move on to Nicole Adams. Go ahead and unmute yourself.
Hi, everyone. Nicole Adams with Human Services, specifically adult protection and child protection intake. I didn't have anything as eloquent as Matt prepared to say today, other than congratulations and awesome work that this group did really consistently over the last several months. And even though we haven't even launched our pilot, my departments have already benefited from the increased collaboration, communication, and even relationship building of this team. So it's been really neat to already see some movement on some cases that we were working. We did some case studies, which were really interesting, and I think helped us with our process and just how we're going to kind of come together and work together. So thank you for being part of it. It's been amazing. It's exciting that we're moving to the next step. So thank you to everyone.
Thank you, Nicole, to help us understand from the county side the impact it has upon us. Our Human Services Department does a great job, and you are a fine example of the reasons we keep on trying to reach out to the community. Thank you very much.
Thank you.
All right, we'll have time for one more comment. Go ahead and raise your hand. Seeing none, we'll go ahead and turn it back over.
Ms. Strait.
Thank you, Commissioner, and thank you to all our partners that took the time to join us today. I do want to just mention that I also want to thank Health Management Associates, our consultant who's helped us not only write the blueprint, but has helped us immensely in putting the structure together so that we can have a successful pilot for the CARE Compact. We also are working on a universal release of information that is in the works in addition to the MOU that you have before you. And we are very dedicated to collecting data that will not only tell us sort of the outcome of the collaborative and how well it's working, but will really help us measure whether people's lives are better. And so we're very dedicated to data collection that has value in terms of not only kind of reporting to our partners and to elected leaders, but also to really holding ourselves accountable to improving people's lives. So with that, I'll turn it back over to you, Commissioner.
Thank you, Ms. Drake, and thank you, everyone who joined us. We really appreciate that. And now I'd like to call on Commissioner Thomas, if you are ready to ask any questions, make any comments. Commissioner Thomas?
Thank you, Commissioner Partridge. You know, it is really an honor to have listened to about 45 minutes of people talking about partnering together to help our most vulnerable citizens. So my screen has gone all digital. Can you all still hear me okay?
Yes, we can.
Okay, good. So let me just say that I was serving as the county coroner on January 31st of 2014. And that's when there was a really tragic situation that happened in Douglas County. A young man whose mother had been working with the county attorney's office trying to get her son, who had some severe mental health issues, help. And the case fell through the cracks, and it resulted in this young man taking his mother's life and his mother's life and then his life. One of his sisters had jumped out of a window to escape from him and was paralyzed from that. And so from that awful tragedy is this beautiful program that I've sat through some of the meetings, not all of them that all of you have sat through, but I have been amazed as I have sat and listened to these meetings, how you all know your topics so well. You know how your clients need help. And by all of you coming together, we are going to really help people from falling into cracks and those who are suffering either from mental illness or substance abuse can get help and hope, but also those community members around them who support them are going to be much better off. Their quality of life is going to be better. And this is about partnership, which is how Douglas County always does things so very well. Leandra, I have not met you before, but I was very impressed with your command of the topic and knowing what you need to do to get this pilot project started with the first 3 to 5 test cases. I was very impressed to see how the list has been developed with the criteria of who can be helped and how they are going to be helped. Many of you, Bill, Doug, Amanda, Sharon, I've sat with you in these meetings. I've talked with you individually, and I know how much you care about pulling all of these systems together to help people. And one of you said this is about making a difference in people's lives, and that absolutely is what this is all about. And so I would just like to thank each and every one of you, Barbara Drake for pulling these people together, Laura Cinconi, Maggie. I know I'm missing a bunch of you. I'm sorry I'm missing your names, Matt, but thank you for caring for our citizens and working together for a better outcome for everybody. Thank you, Commissioner Partridge.
Thank you, Commissioner Thomas. Ms. Drake, I have to go back. Was it 2016?
We started in 14. We hired our coordinator in 2016, and that really got us jump-started.
And I remember, I believe it was Commissioner, our present U.S. Marshal Dave Weaver, Commissioner at the time, and I sat in a room and we heard Ms. Drake present to us, and I have to say, trying to understand what all that meant. And analyzing, there was a cost, there was an expense, there was employee time put in. But Barbara, you laid out such a well-organized and heartfelt need. Certainly, as Commissioner Thomas mentioned, the case, that really brought it to light, the need. And to look where it's gone now, how has it evolved just from one CRT team to 2 to 3, now 4, and to see the results. And you always would say, well, what's the ROI? It's easy for me to think, and I'll go through a couple, but please add more, because I know there is. Because that's one of our duties, being the fiscal responsible individuals. We look at that. What's out of this? Well, the obvious is there's individuals that are out there in need, and great need. And it's not that they choose to do to cause a demand on government or other individuals or other services, but they are in need. This is meeting that need, and now you go into the continuum of care. What a great idea. But as we also know, we certainly have some of the hospital systems involved. We heard that within that first year, well over, I think maybe even the first 6 months, it was almost $1 million in savings, where those individuals were sometimes taking ERs and the emergency department physicians, and individuals there caring wanted to help, but were pretty much at a loss what to do. So it really put our hospitals in a position, and it was the runaround. And again, here's that individual not being cared for properly. And then knowing that, can you remind us how many arrests have come from the community response team since this has been initiated?
So to your point, we have the system ROI and we have the human ROI. And some of that is more difficult to calculate. But we know that these community response teams have responded to more than 4,000, had made more than 4,000 contacts since their inception in May of 2017. And while we have dealt with some people that have been in the criminal justice system and had prior arrests, the 4 community response teams, the officers that man those teams, have not made a single arrest since the program started in May of 2017. We've greatly reduced the number of visits to the emergency department. We've greatly reduced the number of calls calling the fire department and EMTs out to the scene for these individuals, and we have greatly reduced them having M1s written and being taken to the emergency department, possibly then transported to a psychiatric setting. We've been able to streamline that, and for people that need to go to some kind of setting, they've been able to be taken there directly, in large part because of our partners in the mental health arena, especially those that offer inpatient programs. So we know that just in the area of savings with regard to the system side, it's in excess of $5 million. But we also know we're saving the costs when someone gets arrested, of all the costs associated for them and their family. We know we're saving the costs of what an emergency room visit not only means to the hospital, but means to the individual that's taken there. We're getting people connected directly to services. And what the Care Compact will do, as you can see, we're not shying away from the most complex situations. When you listen to Leandra talk about having multiple issues, multiple qualifications, in a sense, to be considered for the pilot, we're really looking at people with the most complex needs. And they tend to be known to many parts of the system, as folks have mentioned, and you have expenses associated with their involvement in all these different parts of the system. And then the human ROI is people not getting what they need to get better, to safely live in the community, to not continually come in contact with law enforcement. And so we think that even the numbers that we have that are more kind of the system savings vastly underestimate what we think the benefit will be for our community.
Wonderful, thank you. And added to that, no doubt it lays out very well. You look at what's been the cost with the expense, and with the county taking this on initially, but it has evolved there. We've seen the municipalities, we've seen all the service organizations, the expansion regionally this is turning into is phenomenal. Can you talk a little bit about, because this is one thing we talk to other counties about, and we talk to our state legislators. And Barbara knows where I'm going with this, that I really believe it's local control is where we've seen this work, local and regional control. I know there's been some input from the state. I believe there has been. Can you talk a little bit about it? We have had some assistance through a grant program through the state.
So we do currently receive a grant from the Office of Behavioral Health, which is part of the State Department of Human Services, and we will have received that grant for approximately 2.5 years. It ends next June 30th of 2021, and we use that to help bring on the clinicians for one of our 4 community response teams. But we are in the process of figuring out, how we'll continue with that post-grant. We also are in talks with the state to really think about co-responder programs as part of the overall crisis response for the state, because we know that many of our partners around the state that have co-responder teams rely exclusively on grant funding, unlike Douglas County that has gotten tremendous support from the commissioners and from the general fund, where most of our support for the co-responder teams comes from, along with in-kind support from all of the fire department districts that partner with us and the law enforcement jurisdictions provide all their services in kind. We are working at the state level, and we don't want them to, as you pointed out, we don't want them to tell us how to run a program in our community. We think that we understand what Douglas County's needs are. But what we would like from the state in their leadership around consolidation of behavioral health is to recognize the importance of co-responder teams as part of the state's crisis system and potentially consider some funding associated with that for not only us, but for our partners all around the state that are trying to run co-responder programs, because we think that we know that law enforcement is always going to be key in terms of getting these calls about suicidal subjects or about welfare checks when a family member is concerned. And we think having this dedicated program is the model. And so we will continue to work with the state and partner with the state, but it really is, I think, to help clear the path for us to do it in a way that we know makes sense for Douglas County.
And Ms. Drake, I have to also compliment you on your hires, Mrs. Cianconi, Mrs. Montoya. Again, I agree with Commissioner Thomas, very impressed. They have just been stalwarts of getting this through. They present it very well, and it's obviously they know how to communicate with our regional partners. So
I always like to hire people that are brighter than I am. I consider that one of my best attributes.
Yeah. Well, I may beg to differ on that, but I know you've hired some phenomenal people that really makes a difference.
We have a great team, and Maggie Cooper is a part of that as well.
Yes, real addition. And I miss them on the 3rd floor now. They moved to different offices.
I know.
So we always like to, we'll say hi to them here. Commissioner Thomas, additional comments or any further questions?
I'm just really pleased to have been a part of this and to have watched all of these partners come together. And I'm ready to see some good work and some great outcomes, because I know that this team is going to provide that. Thank you.
Well, and I'll ask if there's anyone else, any other partners, anyone else who would like to offer anything further.
This is your host. If you'd like to speak, go ahead and raise your hand.
Okay, very well.
I see no hands raised.
No hands raised. Okay. Again, we're just overwhelmed. The regional support that has come forward this and really see this evolve, and it'll be interesting because I know it's not done yet. There's going to be more coming. So with that, I'll bring it to Commissioner Thomas. Would you like to make a motion?
Thank you, Commissioner Partridge. I have a motion to approve the CARE Compact Memorandum of Understanding.
I will second that. Any further discussion? All in favor?
I have not.
Very well. All in favor, say aye.
Aye.
Aye. The motion passes, and congratulations, Ms. Drake, and everyone involved. We are so thankful, and we look forward to more coming.
Thank
Great
you.
things.
Thank you, Commissioners.
All right. That concludes our special business meeting. We are adjourned.